Lots of people talk to me and say, I have to have a root canal, or I'd rather have anything than a root canal, and they tell me a terrible story about a root canal. Statistically, about 90% of the time, a root canal, it doesn't feel sore. But about 1 out of 10 can be sore because of the infection that used to be around the tooth, or the problem with the angry tissue around the tooth. What is a root canal? Basically, there's been some trauma to the tooth. This looks like a molar here. Do I have it in the picture there? Good. There's been some trauma to the tooth from decay or a football injury or something. The nerve inside of the tooth dies and it gets an abscess down at the base of it. And usually when people are talking about a sore tooth that needs a root canal, they're describing an infection. So a lot of times you'll get antibiotics that you'll need to take before you start one of these. What a root canal does is there's a hollow part inside of the tooth, and you make a hole in the top and go through the tooth and clean out the dead or dying nerve out of the tooth, and then put a medication where that nerve used to be. That's what a root canal is. It's kind of a glorified filling. After you get a root canal, you almost always have to have a crown to support it so that the tooth doesn't break afterward. Sometimes there's some soreness afterward because there's a ligament that's still attached that connects the tooth to the bone. And sometimes that ligament is sore. And when people talk about soreness that happens after, it's usually because of the ligament around the tooth that's inflamed. So you have to take some medications for that, and it usually clears it up fairly quickly.